Hello and welcome to the show. Always a pleasure to get to finally have a sit down where we are having you as our viewers. So feel very much welcome. This is The Nest. My name is Vivian Degwa and we are coming to an end of the month of July. And in case you didn't know, now let me let you know that July is usually Fibroids Awareness Month. Yes, it is a month where it is dedicated to just speak matters fibroids, get to look into matters fibroids or fibroids, however you want to call it, and just to spread awareness on it. And just to let you know why it is very important for us to be having this conversation today. Just to look at some statistics, it shows that up to 80% of Black women will develop fibroids before the age of 45. 80% is a huge number, and generally statistics also show that between 20 and 80% of women develop fibroids by the time they get to the age of 50. So a very needed conversation, if you may ask me. And what better way to have this conversation than to have it with a medical practitioner? And today we have Dr. Sarah Mora. Welcome to the program.
Thank you so much, Vivian. It's always an honor to be here and an honor to also contribute to the information we need to create awareness for medical challenges.
The pleasure is all ours to have you here today. So let's just deep dive into it. When you talk about fibroids or fibroids, what exactly are we talking about?
So one of the things that we carefully have to discuss is the womb, which is the uterus of the woman. We must not relegate the importance of the womb, whether it produces a physical being or a spiritual being. So then the fibroids come in the layers of the womb, which is the uterus, and they can either be inside, which is called submucosal, or can be in the muscular level, which is intramural for muscle, or they can be outside, which is subserosal. So what then, when I talk about fibroids, what am I saying? I'm saying these are growths that come from mutation of a cell. One single cell, unlike cancer, which is several cells.
So these are growths that are non-cancerous?
Majority of them are non-cancerous. We have a very, very small, almost a negligible percentage of people who develop fibroids into cancer. And that's why medically they're called leiomyomas, and then when they become cancerous they could be called leiomyosarcomas, and that does not occur. Very few percentage of people get to that level. Yes.
So that is what we call fibroids? That
is what we call fibroids. Right. But in my office it's a leiomyoma.
But right here we have to use terms that at least people will get to understand.
Absolutely. And then also the people who get there, why do I insist on speaking on leiomyomas, is because people get their ultrasound results and we don't write fibroids. Basically we'll discuss the leiomyoma. So when somebody sees that, they shouldn't say, oh my God, this is this. Now remember what Dr. Sarah said, a leiomyoma is a fibroid.
Amazing. We get to learn something new every day, don't we? So now I've read the statistics, and clearly the prevalence is, like, the numbers are really, really high. So fibroids are quite common. If 80% of Black women, you know, get to have fibroids by the time they are age 45, then it's almost everyone. So what causes this fibroids?
So one of the things that we do know is it's a Black to Caucasian statistics. So genetically the Black people will then have, the Black women will be predisposed to having the fibroids. I also want to put in that men who then use progesterone or estrogen, these are hormones, to feminize themselves, are also at that risk of getting the fibroids. So it's statistically that it will affect more Black people. It's a genetic inclination. Just like genetically Black people will survive diseases despite getting them. So then that's why it is common in Black people. The thing about scanty information in why Black also comes in that when we check on research, there's very few people who go in to check it in the Black population, because the assumption is we remove it, you're fine. So things that don't really complicate medically, people tend not to research too much about it. So that has just been left at genetically. Then the reason as to why perhaps then more Black people will get fibroids is also the coming to see the doctors, and therefore statistically we can gather information more than other places which use non-surgical methods to take care of that. So that's why the statistics could look more glaring for Black people and Black women in particular.
Yeah.
Yes.
Would you say that there's not enough research done on fibroids generally, not just for Black people, but just generally? Because I know someone like Lupita Nyong'o, who's well known, is a champion for that, and she keeps advocating for enough research being done on fibroids.
Absolutely, I do agree that the research is flimsy, and not because people don't care, but because it looks like there are solutions that are working around medical approach to solving a fibroid. It's not something that gets to be complicated unless somebody has sat on a fibroid for too long. The measures are there which make people fairly go back to a normal life, whatever their normal life was. So people don't run into checking research for things that are solvable. It's like the way we don't really have good research for a flu. Because there is a solution that medically you get well. I'm not talking about the psychological and the social and perhaps the financial aspect, but medically, once there's an obvious solution, research then tends to be very flimsy.
So that's the reason why. Simply because, well, it's something that is solvable, so we don't really need to put so much resources into.
And I must add that even statistically, sometimes when you come to the medical practice, when a patient tells you they have had a fibroid or have a fibroid, we tend to be very nonchalant and c'est la vie about it, because, I mean, we'll solve this, and whatever outcomes are coming from this, we will be able to tackle it and then come to the end of the road, whatever success looks like in a person's personal life.
All right.
Yes.
Before we get into, you know, getting to know maybe some of the symptoms that show that someone may be having fibroids or has the fibroids, are there misconceptions that you would love to demystify around the topic of fibroids?
Yes.
Go ahead.
Number one is fibroids don't become cancerous. We must emphasize that, because people see the word tumor and they think tumor means cancerous. No, tumor is just a growth that is unexpected and can either be benign, which is non-cancerous, or cancerous. The second thing is infertility and fibroids go together. Really, they don't. That's why we are so nonchalant about it. Like if my colleagues know I'm talking about fibroids, like, easy topic, we can deal with this. The only thing that we don't do, that's another myth, is that we hand over patients post-fibroid management and we don't deal with their psychosocial aspect of life, because it affects confidence, it affects relationships, it affects identity. So when medically I have done my work, oh, no fibroids anymore, you'll be fine, I have not dealt with the psychosocial aspect. So that's something that I really emphasize, especially as a certified counselor also, that we must work with patients beyond what we can easily solve. That's one perfect myth. And another one myth is that it has to recur. Not really, it doesn't have to. Another myth is that always fibroids, you have to remove the uterus and the ovaries. Not really. We have systems which have improved in the management based on the type and preference of the patient in this season.
All right.
Yes.
Okay, thank you for demystifying all of those myths and misconceptions. Now, why is it so important for us to have a time set aside to just create awareness about this particular condition that is fibroids? As we said, July is Fibroids Awareness Month. Why is it important for us to have designated months for specific illnesses or conditions?
First of all, community flourishes in wellness. And just as the word disease, the inappropriate affecting of your ease of life is important in how the community behaves and becomes. GDP is affected by how at ease you are. So awareness for every condition, whether be it mental or medical, is very important, so that whatever journey you're going through, first you must know where to get help. You must know the type of help that's appropriate for you. Because I don't believe in copy paste. You and I both, Vivian, are lovely women doing this presentation, but we are so different, yet we love the same thing, awareness. So even disease does not copy paste. Solutions do not copy paste. So awareness is really important for you as an individual to know first that there is help. Secondly, what type of help you can get. Thirdly, what are the outcomes expected. Fourthly, what are the 360-degree things that affect you as a human being when you have that. Whether you survive it, you recover completely for it, or should, in the unfortunate scenario, a recurrence occur. Yes.
Okay. Now let's get to the symptoms. How do I know I have fibroids?
The common one I tell women is periods are not supposed to be painful. Period. Did I say it like
normalized?
Did I try? Period.
Period.
There should not be any pain in your periods. So that's the first inkling to say there could be something in my female structure that I need to be checked. So structural effects are the things we check. So painful periods will be one. And let me just dig deep a little bit on painful periods, because this is important. Should we not find structural, which includes fibroids, then we must check hormonal and psychological, because painful periods should not be present. The second thing I've found a lot of people is bloating and just gastrointestinal changes. So a lot of heartburn, a lot of bloating, some have diarrhea, it's common. Constipation is another thing that we look out for in a woman who presents with discomfort. There is also pain in the lower abdominal region. Recurrent urinary tract infections could also make me want to investigate further. And the other thing that most people don't talk about is painful sex. Now, it could be you're irritated with the person you're having the intimate session with, but it could also be a sign that you could have a structural problem, which could be fibroids commonly. Yes.
So those are the symptoms of knowing if you have fibroids or not. And there could be women who have fibroids, but they don't show any any symptom.
Yes, we have the asymptomatic. Yes, we do have asymptomatic. This is why I am a champion of annual medical checkup. Put it in your birthday, because on your birthday you're doing exciting things about yourself, and we are all about self-care, aren't we? So it's better we do that, and annual checkups do incorporate ultrasound based on what women will require, breast exams. And I must then say, we're talking about the uterus and fibroids, women, it's only a quarter of women who are checking their breasts, and we carry them everywhere, because those two tend to go together. Breast issues and uterine issues tend to pair together. Yes.
Okay, so I want us to go back to the period pain, because if there's something we've normalized as women, and not just as women, but as a society, you know, even your dad knows, she's in pain because it's time for her periods. Even your brothers get to know. So it's something we've normalized entirely as a society.
Yes.
The period pain. Yes. It's kind of normal. I know during my periods, the first day I'll have pains, or maybe the second, or maybe the third, or throughout my periods. When is it, or where do we draw the line between, I know you've said you're not supposed to be experiencing any kind of pain, but we've really normalized it. So when should it be alarming for me when the periods are painful? Like, is it just how painful should it be for me to be like, okay, now I need to go get checked? Because I mean, we've normalized it, and I know that this is how my entire reproductive life has been since the time I started having periods. Every first day of my 4 days of my periods, the first day I have to get the pain. And it's normal, so I always have painkillers and whatnot. So where do we draw that line of normalizing and it should actually be alarming for you? So
in 2025, we have noticed that people normalize pathology. And that's not okay, because there's no day that every month you should have a painkiller unless there's a structural issue, which medically I'm working on to get you out. So when you're in pain, please investigate. I'll repeat: physical, which is structural, hormonal. If this is fine, please, you need to sit for counseling, because trauma then starts registering, like I call it, the vows of the womb. because we talk about fibroids, is relevant to say this, that even how your mother was when you're in the womb can reflect how your periods will be when you are in your cycle, when you start. Who was there for you during the cycle when it started? What were you told? Because this thing of, oh, it's normal, it's not okay for things to be made to be normal. So I would still emphasize, you have painful periods, because I don't get painful periods. Please be checked.
Yeah.
Yes.
So it can actually be psychological?
Very psychological. Very, very psychological, and these things start from the womb. For example, there are people, let me give you a case of a patient I had.
Please.
And she watched her mother with fibroids, and her mother had fibroids before she had her menses. So when her menses started, she automatically used to think that the menses are starting as a sign of fibroids. Now, she didn't dare ask that, does menses mean fibroids? So in her mind, mentally, that every time she was having a menses was just a signal that fibroids were going to come. So when now her pain came to me with what we call dysmenorrhea, which is painful periods, I then advised her, let's check everything, let's be fine hormonally, let's be fine structurally. Found nothing, and I sat her down for a session. And she was amongst the first people who made me actually certify my counseling services, because I realized people come to me and I have the ability to pick out other things outside the physical or the medical cases that we already have. So yes, I would still insist, let's work on what is affecting you psychologically. And again, people are now also normalizing psychological issues. So again, I say no to that. Yes.
Okay. So how would you say fibroids affects a woman's quality of life?
The pain is what I keep seeing every time I talk about fibroids, and the heavy menses. The pain can be mild, moderate to excruciating, and if you get to a place where people have normalized pain, whereby the Swahili word is jikaze. So when people tell you, no, it's okay, you know, these things are there, they're painful, or the XYZ, I find that very unfair, because pain not only creates a rubber stamp of your life, it actually changes a season and your expression of yourself within a season that can be carried on beyond that. So there are things we produce out of pain, not out of love. Remember, I always say it's a very very cut way of looking at it, but for me the opposite of love is pain. So when that is absent and pain expresses itself, it's very demeaning in the first place. Secondly, if it gets to somebody who is, perhaps let me use a word people may relate, a boss lady. She runs the boardroom very well, has her own business, maybe runs her house well, and she's in pain. It demotivates and debilitates them. And then also loss of identity is another thing we get to see. Then poor relationships. I cannot stress enough that part of the reasons why you have to choose a good marriage partner, I said good, not perfect, is during those times of that kind of pain, because it gets overwhelming for men when they see that pain, because it's a pain they can't tactically remove. They need help from that. So again, that's another thing. Relationships suffer. They suffer a lot during the pain for that. And consider the economical effect of having to change pads. People can change up to 8 to 10 times pads a day.
Wow.
So imagine
the heavy flow that comes with that.
It is so heavy. And then you find those ones with heavy flow having clots come out. So they're thinking, what is happening? And maybe I should address this. The beauty of it is that already your cycle is the wearing off of the inner lining of the uterus. So even if it's coming out heavy and clots, it's not that it's eating up on the space should you like to conceive. So it's just the inner lining that continuously gets off during our periods, or even miscarriage, or just the inner lining. So just to reassure somebody with that heavy bleeding, it's not affecting where the placenta should attach. It just affects where it naturally comes off. So you can see that kind of expectations from work too. I've seen absenteeism being a very big deal. for people with fibroids, and especially if they have comorbidities of fibroids and adenomyosis, that becomes such a big problem for especially women. And finally, misunderstanding, lack of support. Caregivers need to be trained, especially the caregivers who come from the home environment.
And that is rare. People don't train caregivers.
Yes.
You know, you have a mother who's sick, you just become automatically like their caregiver. There's no training.
Yeah, absolutely. And that's one of the counseling sessions I do, for medical counseling sessions I do for the caregivers. The love you have for the one who is unwell is not translating to care. We want you to remain that loving person, not the one reminding them, oh, you have not swallowed your medications, you have not done physiotherapy, you've not done this and that. It is so important. So there's that caregiver strain, which strains the relationship of the person who is unwell. So the persons all end up empty, even after we've solved the problem medically, because relationships have not remained the same after that. Yes.
Yeah. Now, you know, we've looked at the numbers, and clearly they are very, very high, you know. Then, you know, numbers showing that by the time you're 45, 80% of you as a black woman will have, you know, had the condition that is fibroids.
Yes.
Is there a way to prevent fibroids? Is there a known way of preventing it, or it's something that cannot be prevented?
I think this is one of those things like with pure research, therefore we don't know that preventive. And anyone who's out there say, I must warn us, please, that there's anyone out there telling you to swallow a concoction to prevent fibroids. I think they could be misled, especially if they are non-medical people, or they're just medical people looking for clickbait. Because we have to speak about that, Vivian. We mustn't have this program and allow people to mislead Kenyans.
Absolutely.
So then we don't have that one that will stop. But here's a thing that I've discovered about disease. Your mental health space is very important. That's what fights everything from coming to you, or fights that which comes to you away from you. Yes.
And are there concussions, since you've clearly stated, you know, that there are no concussions to prevent fibroids, and there's no known way of preventing fibroids as at now. So are there concussions that could help prevent the fibroids from growing bigger? Because I know there are people out here who actually do sell those concussions.
Yes.
You see them online, you see them on TikTok, advertising them, saying you have fibroids, you don't need to go to hospital, you don't need to go for surgery or the non-invasive procedures. You can take this concussion and your fibroids will automatically just shrink.
Now, I want to talk about that as what I was mentioning about your mental health space. And this is where the word placebo effect comes in. Every time I tell you there's a solution to something, your mental space changes. And this is how you align with your creator, who is God. And your mental space saying, I have hope, and hope, which is a desire and confidence, those fibroids will shrink. Or they will. Not the concussion. What you felt, what you thought. That's the placebo effect. And I can stand by that. Because the problem we have is most of these miracles end up in the medical space as failed kidneys and liver. So you don't have fibroid problem, but you now have a liver problem, you now have a kidney problem from the concussions that you are taking. Okay,
let's hold it from there. Let's take a break, and then we'll come back to continue with this very, very insightful conversation. Don't go too far.